News from the Borderland. This is EPAS Unleashed. Hi, everyone. Welcome to EPAS Unleashed. We are back and we're excited to be here. It is February, which is a month full of love, but it's also National Cat Health Awareness. So today that's what we're going to be talking about. We have a very special guest back, Wesley, and he's our cat guru. So we're excited to have him back and talk all about cat health because we know that cats are really good at hiding when they are,
Yes, they are.
sick or in pain. So we're definitely going to be hitting a lot of points to look at and some preventative care. Before we go into that, can you tell us a little bit about yourself, Wesley?
Yeah, I've been here for going on 11 years now.
Wow.
Fun fact, I started here Valentine's Day 2015, so
Oh, wow.
it is kind of an anniversary.
Yeah,
Going to
yeah,
be a
definitely.
11-year anniversary. I've been a vet tech here forever. We came from private practice before.
Okay.
Um, Cats and feline medicine is kind of my wheelhouse, so
Yes.
we'll try and get you as much information as we can today about cats.
Yes, and we're excited to have you. I can't believe 11 years. Wow,
Mhm.
that's crazy. Well, we're very lucky to have you here because we know how much you love cats and, anything cat related. I know everybody wants to go to you because you have so much information. So we're really excited for you to be here for this episode because I think you'll give a lot of good information to the community to hopefully keep their, cats healthy. But one of the most important things with any animal's health is, getting those vaccines. So,
Mhm.
can we talk a little bit about what vaccines are recommended for cats?
Yeah, so much like dogs, there are feline or cat core vaccines. There's different products in this recommended vaccinations. There are some products that are they're commonly termed as FVRCP. Those letters, it's an acronym for all of the infectious agents that vaccine protects against. Most common, uh, the FVR is feline viral rhinotracheitis, or you can commonly think of it as feline herpes. It is a herpes virus.
Mhm.
Um, so that is a viral infection, which means if the cat uh, becomes afflicted by a viral infection, antibiotics don't do anything
Mhm.
because the virus is attacking the body and the immune system's trying to respond to it. But usually, if a viral infection afflicts your pet, there's usually antibiotics prescribed, but that's to treat secondary infections.
Okay.
The virus is kind of doing its damage and attacking the various body systems,
Mhm.
and the result of all of that causes secondary infections. So bacteria are they're kind of thought of as opportunistic infectious agents. So if there's an opening and a weakness in the immune system, that's where they come in. And feline herpes is one of those that kind of weakens the immune system. Um, the other components of those vaccines, uh, you'll commonly see FVRCP-CH2.
Mhm.
P is panleukopenia. CH in some of those vaccine products is feline chlamydia. Um, all of those infectious agents, with the exception of Panleuk, they cause upper respiratory tract infections.
Mhm.
They cause URI symptoms. So that's going to be sneezing, nasal discharge, conjunctivitis or swelling of the conjunctiva of the eyes, producing ocular discharge. Um, Panleukopenia, that is a particularly highly infectious disease. People commonly refer to it as feline parvo or parvo for cats.
Mhm.
So that one is a particularly aggressive viral infection, causes vomiting, diarrhea. It attacks the gastrointestinal tract.
Mhm.
It is incubation period. When we talk about how fast the virus ravages the body before the onset of symptoms.
Mhm.
So, how long once exposed, do you start seeing symptoms. Panleukopenia can be as aggressive as 2 days up to 7 days,
Mhm.
compared to like parvo for dogs
Mhm.
can be anywhere between 7 and 14 days, but panleuk for cats and kittens can be very, very aggressive and can be very, very fatal. Mortality rate is really, really high in kittens that have panleuk without treatment. You're looking at in the 70, 75 percentile of kittens not surviving it.
Yeah.
With aggressive treatment, which we have been tracking that here in the shelter.
Mhm.
Um, we've seen survival rates of about what when we started treatment, roughly 50% of our kittens would pass away,
Mm.
even with treatment. But
Yeah.
with additions and new developments in treatment therapies,
Mhm.
we're now seeing around 70% of our kittens actually surviving it
Oh,
now,
wow.
which is great for our cat and kitten population
Yeah.
here. And uh, most of these treatments are available at your veterinarian, your private practice clinics. They
Mhm.
generally every vet follows more or less the same treatment plan. So what works for us works in the private practice setting too. Um, Feline chlamydia,
Mhm.
another upper respiratory tract type infectious agent. You will see again conjunctivitis, swelling around the eyes, ocular discharge. All of them kind of mirror and mimic the same symptoms. Um, the other really infectious upper respiratory agent there is feline calicivirus.
Mhm.
That one's kind of an oddball because there are many different strains of it.
Okay.
Some are really, really aggressive and do strange things, and
Mhm.
others are more standard, run of the mill, standard upper respiratory tract type symptoms. But there are mutations of that viral and infectious agent that uh, will cause ulcerations of the hard palate, tongue, and gums in the mouth.
Mhm.
There are some strains that have been documented to cause lameness in limbs. So, around the joints of the forelimbs or hind limbs at the stifle or the knees,
Mhm.
will cause cats and kittens to go lame.
Mhm.
Uh, Very strange occurrence. So there's many different strains of that viral infection that just kind of do all sorts of weird things.
Yeah.
But those vaccines, uh, when you start those booster series for your kitten or your
Mhm.
cat, those are the infectious agents. Generally, those are the main ones that those feline core vaccines protect against. There are some new products on the market now
Mhm.
that have FELV or feline leukemia virus
Mhm.
added in there.
Mhm.
That's kind of a bonus product, which is uh, very beneficial. That infectious agent is a viral infection. Um, that is it belongs in a family of viruses called retroviruses. So those types of viruses, they kind of embed themselves into the animal's genome. Virus replicates and it results in the patient being immune compromised. So there are, I would say, up until recently, um, some vets and some people in various communities used to think if your cat was diagnosed with FELV,
Mhm.
that it was a death sentence
Mhm.
and euthanasia would be the recommended course of action. But
Yeah.
there's since 20 around 2020,
Mhm.
there's now a wealth of new data that shows us that just because a cat is diagnosed with FELVs doesn't mean it's a death sentence. The the virus goes through an ebb and flow.
Mhm.
There are some periods of time where you could test your cat for FELV 1 year,
Mhm.
positive. Next year you test your cat, it'll be negative. And the
Mhm.
virus kind of goes into remission.
Okay.
Um, FELV and feline herpes kind of share this in common,
Mhm.
in that they result in the patient being immune compromised. But when those viral infections go into remission, um, the cat will live a normal, happy, healthy life,
Mhm.
but the virus can flare up, so to speak, when the animal is stressed.
Okay.
So stressful conditions when they produce the stress hormone cortisol, right?
Mhm.
Just like with us too, when cortisol spikes, they
Yeah.
become stressed. That creates an opportunity for the virus that's still existing in these patients to replicate and to do its damage.
Yeah.
So keeping your cat stress free is the best thing for them.
Yes. Yeah, so that's a lot of I'm glad you're saying all these words because some of the diseases I'm like, how do you say it? that? But also one that we, of course, have our cats get is the rabies vaccine. Can you talk a little bit about that and the importance in that?
Yeah, rabies vaccinations. That is a particular nasty viral infection. Um, it You see it in carriers in wildlife.
Mhm.
So the primary vectors for that viral infection are bats, skunks, foxes, and coyotes,
Mhm.
and raccoons.
Yeah.
So though here in Texas, those are the top five.
Yeah.
Um, uh, that viral infection is a zoonotic viral infection,
Mhm.
meaning that it can affect every living, breathing mammal.
Mhm.
There are some mammals who are lower risk for infection, and those are generally rodents.
Mhm.
Doesn't mean they can't get it, just means that they're lower risk.
Yeah.
But of course, our cats and our dogs, especially if they get out, uh, they run the risk of being exposed to those wildlife vectors. So inoculating them with the rabies vaccine can help protect them if they come into contact with one of those five vectors and become exposed to it. That viral infection, it attacks the body's central nervous system. So at the site of exposure, say for example we were bitten on our arm,
Mhm.
uh, the virus will exist in the muscle, starts replicating and traveling to the nearest uh, nerve system.
Mhm.
Once it makes contact with the nerve system and then begins traveling up our arm, up our shoulder, and is trying to reach our spine. Once it
Mhm.
reaches our spine, travels up to the brain, and then it starts ravaging the brain. That's when you start seeing all the trademark neurologic symptoms.
Yeah.
So sudden changes in behavior or temperament, the aggressive
Yeah.
observations, seizures, tremors, uh, uh, the stereotypical foaming at the mouth,
Yeah.
hydrophobia, or the
Mhm.
aversion or the fear of water.
Yeah.
When that happens, patients will usually um, they'll pass away from dehydration
Mhm.
because they're no longer wanting to drink water anymore because they have a severe aversion to it.
Mhm.
It's either that or you succumb to the neurologic damage,
Yeah.
and um, uh, that applies to pets too, as well as humans. So
Mhm.
that's a particularly nasty virus,
Yeah.
and getting that rabies vaccine is so crucial to prevent that level of suffering in our pets.
Yes. Yeah. So definitely want to be proactive and get all those vaccines done for our cats and our dogs and all the pets. But let's talk a little bit about obesity in cats. I know everybody loves a good, fat cat, but can we
Oh
talk?
Lord, he a coming.
Yes, yes. So how can we maintain their weight and what is the importance of that?
Okay. So, maintaining a healthy weight. Um, Cats generally, it's recommended that you feed them at least twice a day or
Mhm.
free feed.
Mhm.
Because cats by nature are what we call grazers.
Mhm.
Sometimes they don't eat everything in one sitting.
Yeah.
Sometimes they go back to it.
Yeah.
But of course, every cat is different, just like every person is different.
Yes.
Not everybody follows the same rules. There are some cats who, if you free feed, they will feed,
Yes.
and they will keep eating. They will keep eating. They will keep eating. Um,
Mhm.
and that's a behavior quirk of that particular cat.
Mhm.
Um, So if you have a cat that's like that, maybe the best option for him is not to free feed, and you want to
Mhm.
portion feed,
Yeah.
uh, like 2 times a day.
Mhm.
Um, Being obese as a cat comes with its fair share of issues.
Mhm.
Generally speaking, this applies to dogs too.
Yeah.
Generally, the more obese the patient, as they grow and develop later on in life, they become more prone to severe afflictions of arthritis.
Mhm.
Right, the heavier the patient is, the more pronounced their symptoms are, the more painful they can be, because
Mhm.
they're uh, that chonker's lugging around 20 pounds of extra weight that his joints just can't handle.
Yeah.
So keeping them at a healthy weight, you should always strive to do that. And you do that through proper feeding,
Mhm.
maintaining correct portions for your feeding, and activity.
Mhm.
The best way to maintain your pet's weight is getting engaged with them.
Mhm.
Be active with them, engage and play with them,
Yeah.
because that also keeps them stress free.
Mhm.
They have an outlet to release all of that pent up uh, primal urges, right? Even though our small house cat is amazing, sweet, and everything you could ever want for in a cuddly, fluffy pet, he's no
Mhm.
different than a Siberian tiger.
Mhm.
Like, those same instincts are present. The
Yes.
the prey drive, the urge to chase something,
Mhm.
that doesn't that exists in Fluffy, the small domestic house cat, and a
Yes.
Siberian tiger. They're all the same. I'm sure people have seen um, videos of the big cats at zoos playing in boxes.
Yeah.
They're no different. They're
Mhm.
Cats are all the same regardless of size. So keep them engaged, play with them, keep them active. Heck, get them a harness and take them for a walk if
Mhm.
you have a cat that wants to do that. Just keep them properly fed and keep them properly engaged in activity.
Yeah, enrichment is super important for all pets
Hmm.
because a lot of people, they think maybe a walk is enough for their dog or their cat doesn't look, too obese or anything like that. Like they don't really need to exercise, but it's more of like a mental, stimulation for
Stimulation.
them.
Yep.
So it's definitely really important. Can we also talk about dental disease? Because I
Hmm.
know that that is something that is really common. And with cats, I feel like not a lot of people, oh, I'm going to brush my cat's teeth, or even dogs too.
Hmm.
But can we talk about that and the importance
Dental
of it?
health, yeah. Um, Cats, if you, depending on what your diet is for your cat,
Mhm.
or if you're a canned food person, or are you a kibble person,
Mhm.
um, both have their benefits. Um, in maintaining dental health. Generally speaking, the crunchier the food is, it kind of helps scrape the teeth,
Mhm.
which is why dental treats are usually the crunchy treats.
Yeah.
But they're, believe it or not, like, they do make toothpaste and toothbrushes for cats.
Yes.
Now, whether or not your cat will allow that, that's up for debate. But generally, you do want to try to engage in some dental health for your pet, whether you want to be active in doing the toothpaste and brush, or just providing them with enrichment treats or types of foods that are uh, good for dental health. And those are usually marketed that way. You can go
Mhm.
to any PetSmart or Petco, Pets Barn, take your pick. There you'll find enrichment, you'll find treats and supplements that support dental health. Generally, they're fairly good, and you do want to maintain it, especially the older the cat gets. Dental disease can affect them very negatively. So if you have a cat that is developing dental disease, it might become harder for them to eat.
Mhm.
If you notice your cat, normally Fluffy eats kibble all the time, and now she's not so interested in the kibble.
Mhm.
9 times out of 10, if you take a peek in your cat's mouth, you'll probably see some rotten teeth or teeth that may need to be pulled out. You might see gingivitis.
Mhm.
Um, those types of conditions do make it painful to eat. And you may need to switch to a canned food diet. Or what you really should do is go to your vet so that they can do dental work on your pet.
Yeah.
That may include a teeth cleaning. If the dental disease is pretty severe, that may include extractions of the teeth. And then eventually you'll end up with a toothless cat, which
Mhm.
um, they are more than capable of living long, happy lives as a toothless cat. We've
Mhm.
even seen some here who've had no teeth and they'll still try to eat kibble,
Yeah.
but just feed them what they want. But to prevent that, you should be proactive
Mhm.
in your cat's dental health, whether that be brushing or in investing in dental friendly food and treats.
Yeah, yeah, better to be proactive.
Mhm.
And it's gonna also, help your wallet at the end
Yeah.
of the day if you're thinking ahead and doing all this preventative care, whether it's with vaccines, the dental disease, or, even just obesity in cats.
Mhm.
Can we also talk about kidney disease in cats? How common is that and what should we be looking for?
So, kidney disease is pretty common.
Mhm.
Especially in male cats.
Okay.
Um, eh, Afflictions of the kidneys, they can be due to infectious agents, they can be due to the presence of stones.
Mhm.
Um, Male cats are more prone to issues with stones. They're more prone to become blocked. We've had many that have come through here where we've had to try to do urinary catheters to unblock them.
Mhm.
um, when that happens, generally those types of cats, they need to go on a urinary diet.
Mhm.
Those types of foods are kidney friendly, and generally they work to try to stop or prevent the development of stones.
Mhm.
There's different types of kidney stones. If they get large enough and they pass through and get stuck in the urethra,
Mhm.
can cause pain. They become blocked. They can't urinate. Those stones can exist in the kidneys, causing pain. Um, if it's an infectious cause for the kidney disease, that's a whole other issue.
Mhm.
Depending on what is causing that type of infection, your cat will generally need to go on some sort of medication, kidney diet, and they'll need to be on that diet for life.
Mhm.
Um, if it gets severe enough, uh, generally a cat that has chronic kidney disease, the longer it goes on, uh, mortality rate generally becomes pretty high on that if you
Mhm.
don't intervene,
Yeah.
because without the kidneys
Yeah.
can't do much of anything.
Yeah, exactly. And here, I mean, we've heard it a lot with owners that are having like issues with their cat. They're wanting to surrender because they're having like behavior issues. And a lot of it stems from like litter box
Mm,
importance. Can
mhm,
we talk a little bit about that? Because I know that sometimes owners, they're not aware of like how important a litter box is.
mhm, yep. So doing our business outside of the litter box.
Yes.
Um, it can be behavior related or it
Hmm.
can be medical related. And this kind of ties into kidney related issues. Um, if a cat is experiencing pain when urinating or even pain when defecating, or if there's some other underlying condition going on, sometimes cats, uh, whether it's their intent or something else, doing their business outside of a litter box is generally a sign that something's wrong.
Yeah.
And it's usually a red flag to what is it that I need to address? Do we need to go to a vet, check you out medically?
Hmm.
Medically, are you fine? Then what is it that you need at home? Are you stressed? Do you need more enrichment? Are you an angry teen and this is your way of
Yeah.
lashing out at me?
Hmm.
What do you need from me? So
Yeah.
if you rule out which it is, usually the medical related items, if you visit your vet, they can be sorted out
Yeah.
and treated.
Hmm.
The behavior related stuff, is it a multi cat household and
Hmm.
there's not enough litter boxes,
Yeah.
and you have a cat that's just, oh man, forget these guys. I'm going to go do my business over here. That litter box is too crowded.
Yeah.
Could be that.
Mhm.
It could also be that your cat is not getting enough enrichment. He's
Mhm.
bored. He's stressed.
Yeah.
Could be any of those factors if it's behavior related.
Yeah. Yeah, and that's why it's so important because, of course, pets, they can't speak our language. They can't talk to us. They can't tell us what's going on. But as a pet owner, we have to make sure that we check all of our boxes. We're going to the vet because a lot of times with these different behavior issues, it's stemming from an underlying health issue. Or if we rule all of that out, okay, now what? What can we look at? What can we do? And it's important for pet owners to do, their research and to do what's best for their pet because they should be treated as family. And with that, senior cats, they do require a little bit of extra
Mhm.
care. So, can we talk about caring for senior pets?
Senior cats. So generally, senior cats, they can have ailments from many different afflictions.
Mhm.
Could be dental, could be kidney, could be thyroid, um, could be arthritis, could be any of those conditions.
Mhm.
But the older cat gets, once they enter that senior territory, I would say once your cat, excuse me,
Mhm.
once they get to between that age range of 5 to 10 years,
Mhm.
your cat should be considered a senior. You
Yeah.
should, at minimum, you should be taking your cat to the vet every year, and just so their health can be tracked.
Mhm.
Um, but generally speaking, the older a cat gets, and we do it here at the shelter, some of these old timers, you want to be more concerned about their kidney health.
Mhm.
You want to be concerned about their dental health.
Mhm.
Generally, these guys, it's not a bad idea to put them maybe on a canned food exclusive diet.
Mhm.
Or if you don't want to do that, you can mix it up with canned and kibble. Maybe do a kibble feeding one session
Mhm.
and then offer them canned in the other. The canned food has the added benefit of helping them maintain hydration.
Mhm.
Cats generally, um, if they're on a canned food exclusive diet, for example, generally they won't want to drink a lot of water because they're getting most of their hydration from their food.
Mhm.
And this kind of ties into their relationship with the whole feline family and the big cats too.
Mhm.
They generally, the whole family of felines, they're what we call obligate carnivores,
Mhm.
which means they eat meat
Yeah.
and they get most of their hydration from muscle and tissue,
Mhm.
right? Muscle tissue retains a lot of water.
Mhm.
And they get most of that from eating muscle and meat.
Yeah.
Um, so canned food kind of facilitates that. It's very water rich.
Mhm.
A hydrated cat is a healthy cat.
Mhm.
A hydrated cat has healthier kidneys. Um, so generally, when they get old, maybe consider switching to canned food or incorporate some canned food into their diet. Um, because the older they get, if they just eat kibble for their whole life, not I'm not saying that it's gonna happen, but they're more at risk for developing kidney related issues
Okay.
because maybe they're not drinking enough water.
Yeah.
They're eating their kibble, but maybe they just don't want to drink enough water.
Mhm.
And there's now a whole market of hydration supplements for cats.
Mhm.
Purina has Hydrocare, which is available as a hydration supplement for cats. So there's a lot of these issues have been recognized over the years, and there are companies that are involved in trying to make their pets' lives better
Yeah.
through supplements. So that's one supplement that's on the market that's available right now to help you with kidney health and hydration health. Thyroid cats, um, those you definitely want to make sure you're going to the vet for because that needs
Mhm.
to be identified. Um, a a thyroid cat, so that affects the adrenal glands.
Mhm.
Um, a hyperthyroid cat will generally have muscle loss. They'll be thinner, um, and they could be eating like a 20-pound obese cat, but they
Mhm.
can't gain weight because their
Mhm.
adrenal glands are telling them they can't.
Mhm.
That needs to be identified as well in older cats, and that's via blood test.
Okay.
So always make sure that you're keeping up with your vet's yearly visits for your cat,
Mhm.
so that that stuff can be identified and can be treated.
Yeah. Yeah, definitely having any senior pet is guaranteed, vet visits,
Hmm. Guaranteed.
more vet visits. But speaking on senior cats, I know that we see a lot of cats come in here that are unaltered and they have, some health issues. Can we talk about the importance of spaying and neutering?
We'll talk about this all day, every day, right?
Yes.
So, uh, neutering male cats, the sooner you do it, the better. One, because it can deter and prevent the developments of those unwanted behaviors,
Mhm,
spraying, marking, mounting other animals. But there's also the added health benefits of reducing risks of certain types of cancers.
mhm,
So in male cats, if you neuter them early, like 1 year and under, you can avoid a lot of the behavior problems and health problems that may
mhm.
arise in the future.
Yeah.
Um, it also, have you ever seen those tomcats with those big thick cheeks, their
Oh, yes.
jowls, right? So the older a male cat, an older a male cat gets, if they
Mhm.
go unaltered, that's what causes the development of the jowls. So,
Okay.
right, that's just uh, when they get to around 2 years of age and older, if they're
Mhm,
not neutered, they more often than not will already have those behaviors of
mhm,
marking, spraying, and mounting. Like those are dominating behaviors because now uh, their hormones
mhm.
are kind of in overdrive
Yeah.
and they're like accumulating in the cheeks. That's what causes the jowls.
Oh, wow.
Um, so if you neuter a cat before generally 2 years of age, you won't get
Mhm.
jowls. Some
Okay.
people like the jowls, but it comes with its own host of behavior issues.
Yeah.
But of course, cats that come into the shelter off the streets, we have no control over that.
Yeah.
If we get a big, thick-cheeked cat, it is what it is. We're still going to neuter you. You can
Yeah.
still be adopted if you're happy, healthy, friendly.
Mhm.
If you're not so happy and you're feral, then you'll go back as a community cat and you'll still be able to do your thing.
Yeah.
Females, getting them spayed before their first heat cycle is
Mhm.
ideal, because that will also prevent a whole host of health issues.
Yeah.
Spaying a female can prevent most types of cancers that infect or that afflict the female reproductive organs.
Mhm.
So ovarian cancers, ovarian cysts, things like that. Infections of the uterus
Mhm.
can prevent that. Um, Sooner you get that done, the better. And there's still like this perception, and it exists with dogs too, where
Mhm.
I want my pet to have their first litter to foster that motherly mentality. No,
Yeah.
that's not a thing. It doesn't exist.
Yes.
No matter how much you want it to exist, it's not a
Mhm.
thing.
Yeah.
Um, Putting them through having litters just puts them more at risk, right? The more
Mhm.
an animal can breed, a female specifically, puts them more at risk for cancers.
Yeah.
And we see this time and time again with many dogs and cats that come through here. They not only may they have like a pyometra, which is an infection of the uterus,
Mhm.
um, cancer. We also see mastitis.
Mhm.
So the mammary glands, they become uh, rock hard.
Mhm.
Sometimes those can develop into other types of cancers, and
Mhm.
generally they need to be resected surgically.
Mhm.
So just to avoid all of that, don't let your animal have their first litter. Get her spayed as soon as you can, and life will be so much better.
Yeah. I feel like a lot of times, and I'm sure we've said it on the podcast before, but we put our human, wants and
Hmm.
needs onto animals, and they're not the same in that sense.
Yeah.
So, we definitely want to make sure that we're spaying and neutering. As far as cats go, how early can they start reproducing?
So there's no one size fits all, but
Mm-hmm.
we've actually had a cat here
Mm-hmm.
recently. We aged her at about 5 to 6 months,
Mm-hmm.
and she was already showing signs of being in heat.
Mm-hmm.
She was vocalizing. She was doing the booty scuffle. Those are
Yes.
all signs of that. And she was about 5 6 months old, so they can go into heat around 5, 6 months.
Yeah.
There's no one size fits all. Not every cat's the same. So we've seen it at 5 and 6 months. We've also seen them at close to a year.
Mhm.
You'll never be able to tell. Sometimes um, where they are in their development cycle, how the environment is,
Mhm.
can play a factor in that. Cats are what we call female cats. They're what we call induced breeders.
Mhm.
So if the environment is right, if their biological conditions are right, they'll go
Mhm.
into heat.
Yeah.
You kind of tying this in again to to the big cats in the wild, like you hear when lions, for example, when
Mhm.
a rival male comes in and takes over the pride,
Mhm.
more often than not, they will eliminate the offspring or the young of the previous male. And what does that do? Within a few weeks, those females go back into estrus
Mm.
because now they've been induced.
Yeah.
They have no kittens anymore. The environment is right. There's food. There all of the things in the environment are telling their body go into estrus, go into heat.
Yeah.
So same applies to our house cats.
Yeah.
If the environment is right, they're going to go into heat.
Yeah. And I mean, with cats, we've seen it here also when they're pregnant, what risks are they facing when they're pregnant or when they're going into, birth? Because we've seen it here so
Hmm.
many times before where they're having complications and, their owners wanted them to have that one litter, like you mentioned, but there's so many complications that come with pregnancy in animals. So can we talk a little bit about that?
Yeah. Our veterinarians here have done many emergency uh, spay procedures for uh, complications with the pregnancy.
Mm-hmm.
We've had kittens who have been stuck in the canal
Mm-hmm.
and they passed away,
Mm-hmm.
and and the mother was never able to give birth.
Mm-hmm.
We've had kittens deceased in utero,
Mm-hmm.
and they've been like that for days, just decomposing in the mother. And our
Mm-hmm.
vets get in there and they see the damage that it's done, and it's like, okay, we're gonna proceed with the spay. We're gonna terminate this pregnancy. In many cases, some of them, the babies are already deceased
Mm-hmm.
and they're decomposing in utero.
Mm-hmm.
So our vets will remove it, then we'll start supportive care, antibiotic therapy, and we hope that the mother recovers.
Mhm.
um, More often than not, knock on wood,
Mhm.
we've seen them recover
Yeah.
and they've gone up for adoption and they're able to live their best life now without having to worry about their uterus.
Yes.
But yeah, there have been some pretty harrowing procedures that have been done by our vets
Mhm.
that once they get in there, you just see what happened
Mhm.
and you just are like, man, let's hope for the best. We'll complete this procedure and
Yeah.
supportive care, and we hope that they recover.
Mhm.
And that's if anybody could actually see that,
Yeah.
the shock value would, okay, I'm gonna get my female spayed.
Mhm.
Um, but not many people get to experience or see that side of what goes on when there is a pregnancy complication.
Yeah. Yeah, and I recently had at one of my book readings, I brought a kitten to the story time, and a little kid came up to me and he talked about how his pet had passed because she had complications with her pregnancy, and the other kids were talking about how, oh, I want my pet to have cats or kittens.
No, no.
And he was being the little educator, and he was telling them, no, we don't want that because look what happened to my cat and I miss my cat so much, and just all of these different things. And but we don't want people to have to go through that in order for them to see the importance of spaying and neutering. So definitely would love for people to understand what we go through and what we see, because we're not just saying that to say it really does have so many benefits for
Mhm.
um, pets, and of course with the shelter. So can we talk a little bit about how spaying and neutering not only helps your pets, but it also helps us and
Mhm.
the pets here?
Yep. So, And with cats specifically, this also is so crucial for our community cat program.
Mhm.
Um, we are always, every breeding season, every summer, every spring, we're always busting at the seams.
Mhm.
Um, and the more that we become overpopulated here at the shelter, that puts our population at risk.
Mhm.
That's more opportunities for infectious disease. Some we can save, some we cannot.
Mhm.
Um, we can only do so much with the resources that we have. And sometimes when you're dealing with during peak season, like when we have that 300 to 400 cats, and you have 10, 15 moms and their babies,
Mhm.
not everyone's going to make it.
Yeah.
And that's the sad reality of it. And I wish it wasn't that way, but eh, when it's just intake after intake after intake, kitten after kitten after kitten, um, it makes our job that much more difficult to ensure that we see everyone come through to a happy outcome,
Mhm.
whether it's they're going right back out as a community cat or whether they're going up for adoption and getting into a good home.
Mhm.
Um, the more females we have spayed and the more males we have neutered, it's going to take some time, but eventually we'll get to the point where that level of intake that we see every year should trend down.
Mhm.
And that's what I want. I want
Mhm.
us to be able to adequately care for every animal that comes in, but it's so hard to do that when we're now having to partition kennels for space and
Mhm.
try to ensure that we make everyone survive.
Mhm.
It's difficult, but I mean, we're still, by God, we're still going to try.
Mhm.
Um, but it's just we're playing life on hard mode, and I would rather
Mhm.
play on normal than on hard mode.
Yeah.
So if everybody can spay their females, neuter their males, and prevent the animals, the younger animals coming in here, especially during peak season,
Mhm.
that'll help us out.
Yeah. Yeah. And I mean, there's so many resources for our community as well. We have our low cost spay and neuter program, and then we have other clinics that offer it for low cost as well. So it's just really going to benefit the whole community of El Paso. So it's just really really important. And you touched about community cats and TNR. Can we speak a little bit more about that, because I know March is coming and we all
Mhm.
know that that's usually when kitten season starts and we start seeing those little babies coming in. So can we talk a little bit about that and about kidnapping?
Mhm. So uh, I would posit this question to everybody: who do you think a kitten has a better chance with, their mom or here at the shelter? Everyone should automatically, overwhelmingly answer their mom.
Yes.
Um, so when we remove kittens from their hiding spot or wherever mom had placed them,
Hmm.
bring them into the shelter, we'll do our best to try to ensure that they survive, but kitten mortality is
Hmm.
also very high.
Yeah.
There's no substitute for mom.
Hmm.
There's no substitute for mother's colostrum
Hmm.
in her milk.
Hmm.
Uh, Kitten milk replacer,
Hmm.
it it can't provide the same nutrition and health benefits that mother's milk can.
Yeah.
It works, it does its job, and of course we see kittens grow and develop, and the ones that we save, um, but there's still no substitute for mom.
Yeah.
Um, and this kind of goes back into the reference to lions.
Hmm.
What will happen to a female cat if you take away her babies? In a few weeks, she's going to go right back into
Yep.
estrus and she's going to breed again. And then in another around 60 days, you're going to have more kittens.
Yeah.
So,
Hmm.
female cats, again, are induced breeders. You take kittens away, you will throw her back into estrus and she will
Hmm.
breed again in such a short period of time.
Yeah.
So, we've compounded the issue. Um, I know we think with our emotions and we see cute, fluffy, helpless kittens,
Hmm.
but if they look reasonably healthy, they're chunky, there's no signs of illness or anything. If they're in a reasonably safe spot, or if they are somewhat exposed, don't jump the gun. Just wait wait a minute, mom may be moving them or mom
Mhm.
may be away.
Yeah.
It's not uncommon for mother cats to be away for hours
Mhm.
to feed, procure resources, or if they're in the process of moving kittens to another safer location, um, you'll see kittens seemingly abandoned for some period of time, but that may
Mhm.
not be the case. I would argue uh, if you can't 100% say for certain
Mhm.
that the mom is deceased, or you haven't seen her for uh, a day, 2 days, don't count her out. If the
Mhm.
kittens look healthy, she's
Yeah.
probably around. Um, and I mean, realistically, if a kitten has been without mom longer than a 24-hour period, chances are it's not going to make it.
Yeah.
But again, it's not uncommon for mom to be away for an hour, 2, 3, 4, or sometimes even 5 or 6 hours.
Mhm.
She may be doing her thing, trying to secure resources, and sometimes that takes time.
Yeah.
So that's not uncommon. So please, 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 if they look healthy, don't take them,
Leave them
because
alone.
you're going to throw mom right back into estrus. And
Yep.
then in 60 more days, then you're going to be bringing us more kittens
Yep.
from the same mother.
Mhm.
Um, community cats, right? So, in addition to preventing um, kittens from being born,
Mhm.
um, getting those females fixed. I mean, that's the fix to the problem.
Yeah.
The fix to the problem of nuisance cats is not rounding them up
Mhm.
and having to euthanize them later. That's been done.
Mhm.
That has been in practice in the 90s, the 2000s. In some areas, it's still practiced. We know it doesn't work
Mhm.
because you round everybody up, someone else is just going to roll right back in.
Yeah.
What you want to do is prevent the birth of the kittens.
Mhm.
You want to end the lineage, so to
Yeah.
speak. Um, let let those cats that exist in those areas live out their lives, spayed and neutered. Let
Mhm.
them be stress free, not having to worry about their hormones, trying to procreate, trying to assert dominance over resources or territory. I mean, in some cases they'll still do that, but uh, not to the level of an intact male or an intact female.
Mhm.
Um, Getting that population under control is how we do it.
Yeah.
And spaying and neutering is the key, not rounding everybody up. Um, those cats have existed with us in these urban environments. I mean, this goes back 100 plus years.
Mhm.
I mean, there's you'll see countless images and black and white photos, and there's one that's pretty famous. I think it was in New York City, and it shows a policeman uh,
Mhm.
letting a cat and her kittens cross
Mhm. Yeah.
like the crosswalk. I'm sure people have seen that
Yes.
image. That was
Mhm.
about 100 years ago.
Mhm.
Like we need to coexist
Mhm.
um, with these urban cats in our environment. Uh, they're they exist in the environment because of us,
Mhm.
and the solution to that is not trying to sweep up our mess and round everything up.
Mhm.
These are living beings.
Yes.
They have lives. They have they feel things.
Yeah.
They're no different than us. Just
Mhm.
learn to coexist with them.
Yeah.
Let them live. Every living thing has a right to life, right?
Yes.
Treat them as such. Don't be cruel.
Yeah.
And the community cat program, that's our way of accomplishing that.
Mhm. Yeah, yeah. So, I mean, right now I think it's the perfect time for people to be trapping and bringing them in
Hmm.
before that kitten season starts. And like you mentioned, I mean, it's not their fault they were born outside. They're living beings and they deserve, like you said, life just like everyone else. Is there anything else that you would like to share with our community in regards to taking care of cats?
Love your pets as much as you love yourself and your family.
I think that's perfect to sum it up. Definitely make sure that we're getting our pets spayed or neutered.
Mhm.
Don't bring us kittens
Don't
this
bring us
season,
kittens.
please. Please don't bring us kittens. And we hope that you learned. I learned a lot, and I always learn a lot from you, Wesley. And I
My pleasure.
appreciate you, and everything that you do because you are definitely one of the hardest working employees that we have
I
here.
really
And for the
appreciate you.
past 11 years, I mean, you've changed so many lives and you've changed, you save so many cats and kittens. Every year
It's
I
never
see
gonna
you.
stop.
Yes, I always see you taking on those kittens. And so I really appreciate how much you care about, this job and the animals that are in our community. So
Thank you.
thank you so much for taking time to join us, and we hope you see us next time.